Do coffee and beer actually destroy your prostate? A urologist reveals what nobody tells you. Mr. Antonio drank coffee his entire life, 3 or 4 cups every single day. At 62 years old, he started waking up 5 times a night to urinate. His doctor looked at him and said, "Antonio, you need to quit coffee. It is destroying your prostate." So Antonio quit. He cut it out completely. 6 months later, his symptoms were even worse. He went back to the doctor confused and desperate. That is when he discovered the truth. Coffee was never the problem. In fact, a recent study showed that coffee might actually protect the prostate. But there is a drink that 80% of men consume every single week that really is destroying the prostate in silence. Over the next 15 minutes, I'm going to bust 7 myths about beverages and prostate health. Coffee, beer, soda, wine, juice. I will show you what the science actually says. Pay close attention, because myth number 4 is so shocking, it might make you rethink everything you drink, starting today. First, let us understand the prostate. It is a gland about the size of a walnut, located under the bladder, surrounding the urethra. It produces part of the seminal fluid. It seems small and insignificant, but when it grows, it becomes a nightmare for a man. 50% of men over 50 have benign prostatic hyperplasia. By age 70, that number jumps to 80%. The symptoms include getting up at night, a weak stream, feeling like your bladder is still full, leaking, pain, and urgency. The problem is that everything you eat and drink goes into your blood and reaches the prostate. It either causes inflammation or protects it. It either stimulates growth or reduces it. For decades, you have been taught the wrong things about what actually affects this gland. What I am about to show you is not just my opinion. It is science, recent studies, data that the beverage industry hates for you to know. Because if you knew the truth, you would stop consuming what is destroying you. Myth number 1, coffee enlarges the prostate and worsens symptoms. You hear this in every old school doctor's office. People ask if they can drink coffee, and the doctor says no, it irritates the prostate. That is a lie, a scientific lie. The truth is, a 2021 study published in the Journal of Urology followed 15,000 men for 10 years. The result? Men who drank 3 to 4 cups of coffee a day had a 25% lower risk of developing severe prostate symptoms. 25%. Why? Coffee contains antioxidants and polyphenols. Caffeine can actually reduce inflammation. Studies even show coffee lowers the risk of aggressive prostate cancer. Now, you might feel like you need to urinate more when you drink coffee. That is because coffee is a diuretic. It makes you produce more urine. That does not mean it is harming your prostate. It means it is flushing your urinary system. The problem is not the coffee itself. The problem is drinking it at night. If you drink it after 5 in the evening, you will wake up at night. Not because your prostate is inflamed, but because you filled your bladder right before bed. Myth number 2. Beer has nothing to do with the prostate. This is where things get ugly. Many men believe beer is just water and barley, so it cannot hurt. Or they think a few beers on the weekend is fine. The brutal truth is that beer is one of the worst drinks for your prostate. First, alcohol of any kind irritates the bladder and the prostate, causing inflammation. Second, hops. The hops in beer contain phytoestrogens. These are compounds that mimic estrogen in your body. Do you know what estrogen does to a man's prostate? It stimulates growth and increases inflammation. A 2020 study showed that men who drink 2 or more beers a day are 40% more likely to develop severe urinary symptoms before the age of 60. Plus, beer causes weight gain and increased belly fat. Belly fat produces even more estrogen. It is a vicious cycle. You drink beer, gain weight, produce estrogen, inflame the prostate, and worsen your symptoms. Even non-alcoholic beer still contains hops and phytoestrogens. It is slightly better, but still not ideal. Myth number 3. Soda does not affect the prostate. Whether it is regular, diet, or zero, if you think soda is just sugar and has no link to the prostate, get ready. Soda is an endocrine poison. Regular soda causes insulin spikes and insulin resistance. High insulin levels stimulate cell growth, including in the prostate. Studies link insulin resistance to a 50% increase in the risk of hyperplasia. What about diet soda? It might be even worse. Artificial sweeteners like aspartame and sucralose have been linked to hormonal imbalances. They affect testosterone and relatively increase estrogen. A 2023 study in South Korea found that men who drink soda daily have double the risk of needing prostate surgery before age 70. Myth number 4 is the most shocking. Fruit juice is healthy for the prostate. This is the most dangerous myth because it is disguised as health. People think they are being safe by choosing natural juice over soda. The bad news is that fruit juice often has as much sugar as soda. A glass of orange juice has about 26 grams of sugar, while a glass of cola has 27. Your pancreas does not know the difference. When you eat a whole fruit, you get fiber, which slows down sugar absorption. When you squeeze the fruit and drink only the juice, you throw the fiber away and keep the liquid sugar. It is a direct shot of glucose into your bloodstream. Myth number 5. Red wine protects the prostate. You have heard of the French paradox, right? The idea that wine is good for the heart. The partial truth is that red wine has resveratrol, a powerful antioxidant. But the studies showing protection use concentrated doses. You would need to drink 10 bottles a day to get that amount. In reality, the alcohol in the wine irritates the prostate and lowers your testosterone. If you want resveratrol, eat purple grapes or take a pure supplement without the alcohol. Myth number 6. Milk protects the prostate because of calcium. This is an uncomfortable truth, but recent studies show a link between high dairy consumption and increased prostate cancer risk. Cow milk contains growth factors meant to make a calf grow rapidly. In an adult human, this can stimulate unwanted cell growth. Also, excessive calcium intake over 2,000 milligrams a day is linked to aggressive prostate cancer. If you have prostate issues, try going 30 days without dairy. Many patients see a 40% improvement just by cutting out milk. Myth number 7. Water does not make a difference as long as you stay hydrated. This is very wrong. Pure water is the only drink your prostate truly loves. It has no sugar, no alcohol, and no preservatives. It flushes the system and dilutes urine, which reduces irritation. The secret is drinking it at the right time. Get most of your hydration in before 6 in the evening. Men who drink 2 liters of water a day, properly distributed, have 30% fewer urgency symptoms compared to those who drink less than a liter. To summarize the scientific truth, you should drink coffee, green tea, and plenty of water. Keep the coffee before 5 in the evening. You can have red wine and milk in strict moderation. You should completely avoid beer, soda, industrial juices, and energy drinks. My protocol for patients is simple. Week 1, cut out soda and beer entirely. Week 2, swap juice for whole fruit and drink more water. Week 3, reduce dairy to once a day. Week 4, keep the coffee moderate and add green tea. Within 30 days, 80% of my patients report significant improvement. Mr. Antonio, who I mentioned earlier, went back to drinking coffee, but quit the beer and soda. He started drinking 2 liters of water a day. Within 3 months, His symptoms dropped by 60%. He is sleeping through the night again. He asked me why nobody told him this sooner. The answer is that the big industries do not want you to know. They want you to keep consuming. Now you have the knowledge. Choose one drink you're going to cut out for the next 30 days. Just one. Tell me in the comments which one you chose. Was it beer? Soda? Juice? I will read the comments and reply. Your prostate does not have to be a problem. You can be healthy in your 60s, 70s, and 80s if you make the right choices today. Every sip is a decision. See you in the next video.